new information suggests the coronavirus was spreading rapidly in the U.S. much earlier than first thought. Only 23 cases in several major cities had been reported by March 1st, when very limited testing was being done. The New York Times used a Northeastern University model to estimate there could have been about 28,000 infections in those cities by that time. Dr. Jon LaPook spoke with one of the Northeastern researchers. John, it appears the virus also took lives in the U.S. a lot earlier than we thought.
That's right, Anthony. We thought that the first U.S. death had occurred in Washington state in late February. Now it turns out that there was an earlier death in California about 3 weeks earlier. And as some states are looking to reopen, there are still a lot of questions about the early spread of the virus.
We project by early March thousands of cases across the country.
Dr. Alessandro Vespignani is a professor at Northeastern University in Boston. His research team has been modeling the spread of coronavirus. They believe it likely began in the U.S. in January, and by mid-February, there were about 50 new infections per day.
Those cases were not detected because if you don't test, you don't detect.
Thank you, Mr. Vice President.
Last week, CDC Director Dr. Robert Redfield said the U.S. had been successful in tracing the spread of COVID-19.
Through February 27th, this country only had 14 cases.
But a New York Times analysis of the university's modeling estimates by March 1st, the number of cases was much higher, likely reaching nearly 30,000 in 5 U.S. cities, about 10,000 of them in New York, where social distancing would not be enforced for another 2 weeks.
I think the major problem was lack of testing.
Dr. Matthias Schnurl is a researcher at NYU Langone Health.
The fact that this virus can spread asymptomatically from person to person without causing any disease was underappreciated until recently.
Through genetic analysis, his team found most coronavirus infections in the U.S. did not come directly from China. Instead, they largely came from China to Europe and from Europe to the United States. Travel from China to the U.S. was curtailed on January 31st, but travel from Europe continued freely for more than a month.
If I could turn the clock back and go back in time, there would be 2 things that I think would be critical. One of them would be to put a mask on everybody in the city. The second thing would be to start aggressively testing everyone who was traveling from outside. I think it's important to learn from our mistakes. This is not the last pandemics that we are facing.
Data from a preliminary state survey released Thursday found more than 20% of people randomly tested in New York City were found to have antibodies to coronavirus.
These are people who were infected and who developed the antibodies to fight the infection. 4 weeks ago, 5 weeks ago, 6 weeks ago.
In Santa Clara County, California, officials say CDC testing has revealed the first known coronavirus death in the U.S. occurred on February 6th, not February 29th, as previously believed.
What these deaths tell us is that we had community transmission, probably to a significant degree, far earlier than we had known.
Dr. Vespignani says modeling is partially based on our behavior, so we all have a say in what happens next.
If we stay home when we are asked to stay home, if we wash our hands, if we use masks, well, we might change the trajectory of this epidemic. We cannot change the path of a hurricane. For an epidemic, we can change that trajectory. What we do will change the
It's not the only study that found that this virus was likely circulating in the United States a lot earlier than we suspected. A recent study out of Mount Sinai found that the virus was likely present in New York City as early as late January. Anthony?
All right. Wow, John, thank you.